Hello everyone and welcome back to the channel. My name is Shashank Parmar and in today's video we will talk about the excretion of drugs. So let's begin. First of all, what is the excretion? Here we will see the excretion in the terms of drug excretion. So the excretion is a process whereby drugs or metabolites are irreversibly transferred from the internal to the external environment. It is the process, or we can say excretion is the passage out of systematically absorbed drug. Here the principal organs involved in the excretion are kidney, lungs, biliary system, intestines, saliva, milk and skin. First of all, renal excretion. Drugs are eliminated from the body primarily by the kidneys. Here, especially for those drugs that are water soluble and non-volatile. The three principal processes that determines the urinary excretion of a drug includes, first of all, the glomerular filtration, second, the active tubular reabsorption, and the third one, that is active tubular secretion. Now, glomerulus filtration. As the blood flows through the glomerulus protein-free plasma filters through the glomerular capillaries into the Bowman's capsule. Normally here, about 20% of the plasma that enters the glomerulus is filtered. This process is known as glomerular filtration, which is the first step in the urine formation. Here, the ionized or unionized drugs are filtered, except those that are bound to the plasma proteins. Also allows water and small molecules pass through the glomerulus. It prevents the filtration of large molecules and plasma proteins. Now, what is ultrafiltrate? That is any drug that is free in the plasma water that is not bound to the plasma protein or the formed elements in the blood, that is red blood cells, will be filtered as a result of the driving force provided by the cardiac pumping. All unbound drugs will be filtered as long as their molecular size, charge and shape are not excessively large. GFR, that is normally 120 ml blood per minute. Tubular reabsorption. It occurs after the glomerular filtration of drugs. Tubular reabsorption is the process of returning important substances, that is good stuff, from the filtrate back into the blood vessels. Non-ionized and lipid-soluble drugs having smaller molecular size gets reabsorbed from the renal tubule into the peritubular capillaries and ultimately back into the blood. It takes place all along the renal tubules. Active tubular secretion. It mainly occurs in the proximal tubule. It is carrier mediated process which requires energy. It is the secretion of substances such as waste, drugs and excess ions from the peritubular capillaries into the renal tubule. Here the waste substances ultimately makes their way into the urine through the conducting duct. Now we will see the factors affecting the renal excretion. First of all, the urine pH, then urine flow rate, physiochemical properties of the drug, distribution and binding characteristics of the drug, blood flow to the kidneys, biological factors, drug interactions and the disease states. Now, the biliary excretion. Bile juice is secreted by the hepatic cells of the liver. Compounds excreted by this route include sodium, potassium, glucose, sucrose, insulin through the feces. More the polarity, better the excretion of the drugs. Factors affecting the secretion of drug in the bile are the molecular weight, polarity, sex, species, disease state and the drug interaction. Now we will talk about the pulmonary excretion. The lungs are the major organ of the excretion for gaseous and volatile substances through the process of exhalation. Gases and other volatile substances such as general anesthetics that enter the body primarily through the respiratory tract can be expected to be excreted by this route. For the loss of substances in expired air, simple diffusion across cell membranes is predominant. The rate of loss of gases is not constant. It depends upon the rate of respiration, pulmonary blood flow, the degree of solubility of a gas in a blood. For an example, gases such as nitrous oxide, which are not very soluble in blood, will be excreted quickly and rapidly. The salivary excretion. Some drugs are excreted through the saliva in the mouth. Generally, unionized lipid-soluble drugs are excreted. The bitter taste in the mouth of a patient is the indication of excretion of drugs in the saliva. Some basic drugs inhibit saliva excretion and are responsible for the mouth dryness. For example, caffeine and theophylline. Now we will see the mammary excretion. Some fractions of drug can be excreted in the milk. Low molecular weight unionized water-soluble drugs will diffuse passively across the mammary epithelium and transfer into milk. Less than 1% of drug is excreted in the milk of mother, and the amount of drug consumed by infant is also very less to produce toxic effect. Some potent drugs like barbiturates and morphine may produce toxicity. Nicotine is secreted in the milk of mothers who smoke. Now, the skin excretion. Drugs are also excreted through skin through sweat. For example, benzoic acid, salicylic acid, alcohol, and heavy metals such as lead, mercury, and arsenic. Excretion of drugs through skin may lead to urticaria, and dermatitis. Now, the gastrointestinal excretion. Excretion of drugs through the gastrointestinal tract usually occurs after the parenteral administration. Water-soluble and unionized form of weakly acidic and basic drugs are excreted in GIT. For an example, are nicotine and quinine are excreted in stomach. Drugs excreted in GIT are reabsorbed into systemic circulation and undergo recycling. For clearance, the drug clearance is the fixed volume of body fluid which is cleared of drug per unit time. That is, clearance CL is equals to rate of elimination upon plasma concentration. It is expressed in milliliter per minute. Now we will see total body clearance. It is defined as the sum of individual clearance by all eliminating organs is called total body clearance, or we can also say it as total systemic clearance. Now, what is renal clearance? It can be defined as the volume of blood or plasma which is completely cleared of the unchanged drug by the kidney per unit. That is, here you can see the formula. Renal clearance is equals to concentration in urine into rate of urine formation upon the concentration in the plasma. Thank you so much for watching our video. I hope you liked it, and for further more videos you can subscribe to our channel and also make sure to like the video. You can check out our website, that is www.thescihub.in. Here we upload all the notes related to our subject. Thank you so much.